Hi, my name is Maria Celeste Palis, and today I'm going to talk about intussusception risk after rotavirus vaccination in U.S. infants. Definition: the International Post-Licensure Studies have identified an increased risk of intussusception after vaccination with the second-generation rotavirus vaccines, Rotatech and Rotarix.
Regular trips to the doctor are a normal part of a child's first year. Baby Jose, baby Stanislav, and their moms are here to see their pediatricians at Harvard Vanguard in Boston.
Hi, Stan. How are you?
During this visit, both babies will receive routine immunizations, including the rotavirus vaccine.
Immunization is very important because it protects them against vomiting diarrhea disease that is very common for babies.
Good job, Bubba.
Several years ago, a rotavirus vaccine was withdrawn from the market after being associated with an increased risk of intussusception. In this uncommon disorder, a portion of the small or large intestine slides forward into itself, much like a telescope, causing severe abdominal pain and vomiting.
Because the rotavirus vaccine is given to almost every child in the United States, it's crucial to monitor the vaccine's safety.
Dr. Irene Shui from Harvard School of Public Health and co-authors studied the Rototech rotavirus vaccine, which became available 6 years ago. Almost 800,000 infants aged 4 to 34 weeks received this vaccine from May 2006 to February 2010, including more than 300,000 first doses.
Our study did not find an increased risk of intussusception following the rotavirus vaccine.
The study appears in this week's JAMA, Journal of the American Medical Association.
This result was the same whether we looked at the longer 1 to 30-day risk window following all doses of vaccine, and in particular, when we looked at the first week following the first dose, we also did not see an increased risk.
We're going to do rotavirus. Okay.
That's a little drink.
That's a little drink.
Researchers say introduction of the rotavirus vaccine has a tremendous public health impact for children like Jose and Stan.
The benefits from rotavirus vaccine in terms of reducing the number of hospitalizations and deaths from rotavirus disease far outweigh the potential risk of intussusception that might exist.
Thank you, Angel. Aren't you doing great?
Catherine Dolph, The JAMA Report.
There we go.
Applications in medicine. Medical records were reviewed to confirm the occurrence of intersections and the status with respect to rotavirus vaccination. The primary analysis used is self-controlled risk interval design that include only vaccinated children.
This is rotavirus. Rotavirus is everywhere. By age 5, almost every child in the world has experienced a rotavirus infection at least once. But for most practitioners in the US, rotavirus doesn't keep us up at night. Not so for the rest of the world, as this study appearing in JAMA Pediatrics brings into stark relief. The study is an epidemiological tour de force. Researchers use data from the huge global burden of disease study, which uses hundreds of researchers around the world to collect boots-on-the-ground data on deaths and disability from a variety of causes. Combining all this data requires a degree in Bayesian statistics, as the study design accounts for the inherent uncertainty and sampling error that occurs when you try to, say, figure out how many people have diarrhea in sub-Saharan Africa. The study provides the most up-to-date data we have on the impact of rotavirus around the world. Here are the top-line results. In 2016, there were an estimated 258 million rotavirus infections in children under age 5 around the world. There were 128,000 deaths. In fact, rotavirus was the leading cause of diarrheal deaths in children under age 5, outpacing cholera, Shigella, Salmonella, any other bug you can think of. It was the third leading cause of infectious deaths in that age group, being outpaced only by malaria and strep pneumococcus. In other words, if you want to cut down child mortality due to diarrheal illness, rotavirus is public health enemy number 1. Now, some good news. Rotavirus vaccines work well. Prior studies have demonstrated vaccine efficacy of 50 to 90%. That translates directly into lives saved. The current study estimates that more than 28,000 deaths were averted by rotavirus vaccination worldwide in 2016. The bad news is that only 28% of eligible children were vaccinated. Had universal vaccination occurred, the researchers estimate that an additional 83,000 children's lives could be saved. Fortunately, these vaccines are getting cheaper. Certain developing countries can get a dose for around 50 cents. In the US, with a coupon, you can get a dose at Costco for $125. But the US does not bear the burden of this disease the way the developing world does. The authors estimate that vaccination saved about 25 lives in the US and Canada in 2016. It saved 24,200 lives in sub-Saharan Africa. This is, as we say in epidemiology, significant bang for your buck. Now, to be fair, the study did not model risks of vaccination. In this case, the only real documented risk is that of intussusception. I would have loved to see some data on that, but it's hard to argue that that rate would somehow outweigh the mortality benefits. Just to give you some numbers, the CDC puts the rate of intussusception from rotavirus vaccine at somewhere between 1 in 20,000 to 1 in 100,000. On the other hand, some rough back-of-the-envelope math suggests that for every 4,000 kids you vaccinate, you saved one life. So, we have an effective strategy to prevent this disease. We have the resources to deploy that strategy. But where most of us live, deaths from rotavirus are exceptionally rare. This paper reminds us that that rareness is a luxury, but it's a luxury we can export. For Medscape, I'm Perry Wilson.
Pros and cons. Pros: potential cases of intercession during all person time for 5 to 36.9 weeks of age, irrespective of immunization status, were identified and administered data on the basis of any 3 codes in either the inpatient or emergency department settings. Cons: case status was determined by adjudication that was based on a review of the identified full-text medical records. Cases were excluded if no interception has been seen or alternative diagnosis has been made after surgery or air or liquid contrast enema.
Health Break is brought to you by Rex Healthcare, chosen for excellence.
Rotavirus is one of the most common causes of vomiting and diarrhea in children, in some cases leading to hospitalization. Pediatrician Dr. Terry Brenneman discusses a vaccine for babies to help them avoid the virus.
There's actually 2 companies that make a rotavirus vaccine, and they're made a little bit differently. One product is given at the 2-month, 4-month, and 6-month visit, and one product is given at the 2-month and 4-month visit. And the reason we want to get it into babies early is that it's usually that first rotaviral infection that makes a baby so sick.
This vaccine is oral and easy for a small child to take.
Both vaccines are about 95% effective in preventing severe disease and perhaps about 85% effective in preventing moderate disease.
The parent who makes sure his or her child is on schedule with all their vaccinations, including rotavirus, is truly giving their child a gift that will last a lifetime.
Well, you get your vaccine at your pediatrician's office or the health department. Keenly, it's given at the 2-month, 4-month, and 6-month well baby visits. We do not start the vaccine in anyone over 3 months of age, so it's important to get your baby in on time to get that vaccine started.
For a referral to a physician who can administer the rotavirus vaccine, call Rex HealthNet at 919-784-4490. I'm Melody Hunter-Pillion with Health Break.
Health Break was brought to you by Rex Healthcare.
Issue applied in Ecuador. After the first dose of RV5 with a risk window of 25 days after vaccination, there was found a significant increase in the risk of interception, with approximately 1.5 excess cases per 100,000 recipients with the vaccine, which has approximately 1/10 of risk with the Rotavirus. Conclusion: RV5 was associated with approximately 1.5 excess cases of intussusception per 100,000 recipients of the first dose. The secondary analysis of RV1 suggested a potential risk, although the study of RV1 was unpowered. This risk must be considered in light of the demonstrated benefits of rotavirus vaccination.
Rotavirus is the most common cause of diarrheal illness among infants and young children worldwide. It is a viral infection of the stomach and intestines. It is highly contagious and is spread by coming into contact with an infected person's feces or poop. It's horrible. Symptoms include watery diarrhea, vomiting, fever, and abdominal pain. Rotavirus infection can be severe, causing dehydration, and children die around the world from rotavirus infection. There is no specific medication to treat rotavirus infection. While you can prevent infection by washing your hands thoroughly, the best mode of prevention is through vaccination. There are 2 rotavirus vaccines available, both given to young children before their first birthday. Both vaccines are oral vaccines given as drops in the mouth. The rotavirus vaccine is safe and effective. Talk to your physician for more information about rotavirus.